maybe you're having chronic pain and stiffness. So here's a person from the front. Now they turn them to the side. You can see all the muscles. But check this out. It's going to show one of the bones shifting out of place. There it is. And look what happens to the nerve. So today, in this video, I'm going to be talking about nervous system interference. Hi, I'm Dr. Michael Pasternack, a chiropractor, Winchester, Virginia. I'm with Apple Wellness Center, and I specialize in improving the quality of my patients' lives by reducing or eliminating nervous system interference, which is the number one cause of chronic stiffness and pain. I specialize sort of a subspecialty in chronic pain and stiffness, especially after car accidents, whiplash type of injuries. And so I also have a business name of Winchester Spine and Injury. So on this video, it's like the second part of a little mini series I'm doing entitled, "You Ain't a Leaf, You're the Wind." And so in that video, I was talking about the 5 factors of health. And so we're going to talk about in my mind, the first and most important factor of health, which is having a nervous system functioning optimally. So most people, as I listen to this, are like, what's he talking about? So let's keep this really simple. So our nervous system is made up of our brain, which sits up top, the spinal cord, which comes down, and then all these nerves that go out to all the parts of the body. And you can notice here you have the skull, which is surrounding the brain to protect it, and then you have the spinal cord, which comes down in the middle, and you can see these are all the vertebrae, the bones that protect the spinal cord. And so the brain, the spinal cord, and these nerves, they make up the nervous system. The brain is very delicate, and so is the spinal cord. So they're surrounded by bone to protect it. And these bones, that not only do they protect the spinal cord, but it allows for movement. So you have the skull protecting the brain, and you have the bones of the spine, or what's called vertebra, protecting the nerves. And so the brain sends messages down the spinal cord, which then goes out to the body part and goes back up to the brain, and it's back and forth communication, two-way communication with every gland, system, tissue, organ, and cell of the body. There's over 28 trillion cells in the body, and the brain communicates with each one. And so if you look at that, you could see, like I was just talking about, you could see the bones, and you could see the nerves coming out off of the spinal cord. But here's the thing. While these bones allow things to move, sometimes what happens, and that brings up a great point. I'm going to do a separate video just talking about, well, what causes a bone to shift out of place and pinch on the nerve. But for today, let's just go with that it happens and it's common. I've seen over 10,000 new patients, and so it's really common. But what happens is, this is illustrating normal nervous system transmission up and down the spinal cord and out. That's the green blinking light. But notice if I shift this bone just a little bit, how it starts to irritate that nerve. We call that nervous system interference, or a pinched nerve. So let me show you one more example of that. So if we look over here for just a moment, and we're going to focus in on this. So here's a person from the front. Now they turn them to the side. You can see all the muscles. But check this out. It's going to show one of the bones shifting out of place. There it is. And look what happens to the nerve. That's what I'm talking about. That's nerve irritation, right? That's nervous system interference. That's a pinched nerve. That's what I'm talking about. Here's the point, though. So when a bone gets shifted out of place, it gets stuck there because of muscle memory. The muscles hold it in the wrong place, and our body can't pull it back into the right place. That's what we call a pinched nerve. And the number one symptom or sign I see of nervous system interference or a pinched nerve is stiffness and pain. So that's what new patients coming into my office have. Now, here's a really simple question that I don't think anyone's gotten wrong when I ask them. If the bone is shifted out of place, it's pinching on that nerve. Yes, I'm talking to you right now. If that bone is shifted out of place and it's pinching on the nerve, what do you think we need to do to help get you healthier? I'm waiting for your answer. Right. Nobody's ever gotten it wrong. You have to gently shift it back into the right place. That's what I do. That's what I do all day long. I'm a chiropractor. That's what we do. We help to realign the spine to get pressure off the nerves and reduce pinched nerves. But here's the cool thing. When I do that, patients not only start to feel better, their stiffness and their pain gets less, but it affects all of the other factors that I was talking about on the "You Ain't a Leaf, You're the Wind" video, right? It starts to affect the whole quality of life because now they feel better, their attitude improves, they're doing more activity, they're sleeping better, so it's all interrelated. And the most amazing thing is I wake up every morning myself and I'm so excited to go into the office and help improve the quality of life for my patients. It's a vacation every day. I can't imagine a better thing. So go ahead and watch some of my other videos where I show like adjustments and what it looks like and how gentle it is. Share this video with everybody you know, because I'm pretty sure every single person you know on the planet wants to get healthier, wants to have a better quality of life. They don't want to be a leaf being blown around by the wind. They want to be the wind, right? So share this video. Definitely follow me on social media and comment at the bottom of this video. Dr. Michael Pasternack, Winchester VA chiropractor. Have a great day.